31 minutes past the hour of 12 right here in the city of Douala. Good afternoon, ladies and gentlemen. Thanks for joining me on another edition of the program You and Your Health aired on Equinoxe Radio Multimedia. For presentation, I am Immaculate Fogwe. Despite the fact that the Ministry of Public Health forbids the illicit sale of drugs across the national territory, the business is however thriving in big cities and in hinterlands. In Douala, the hawking of pharmaceutical drugs on streets or their sale in makeshift structures is very common, with a good number of the population relying on the expertise of some of these self-proclaimed health specialists. On today's edition of the program You and Your Health, we are going to be looking at the risk involved when it comes to consuming or taking roadside drugs. Let's go on the short break. I will be right back. Welcome back. With me here in the studio is Dr. Leslie Asanga, a Cameroonian-born U.S. licensed pharmacist, serial entrepreneur, and public health professional. He is the co-founder and CEO of Your Pharmacy, a mobile application that makes it easy to search, find and pay for medications in sub-Saharan Africa. He's equally the CEO of Pills to Me. Good day, Doctor. It is a pleasure having you on the program.
Good day. Thanks for having me.
So, Doctor, today we are going to be looking at the consequences of procuring drugs from the roadside. Why the crackdown against some of these drugs which are being sold on the roadside?
Yeah, I think it is pretty obvious, especially when it comes from the level of the ministry, because they have they have an obligation to protect the public, right? So drugs being sold on the streets or on the roadsides are questionable in a lot of ways, because again, the source of these medications, who knows where they're from, the contents of the medication, nobody is there to be vetting all these people to see if the medications are, they even have the right ingredients in it, and then also there's that professional aspect of it. Like the people selling the medications, it opens up a whole can of worms, because people purchase medications and they get advice from these so-called doctors, right, on the roadside, who are not competent enough to give medical advice, and yeah, so it's a huge problem. So I think the biggest solution to that has to do with educating the public of the dangers of such a practice.
Okay, right now we have some private clinics in Cameroon that sometimes rely on such drugs. They go to this where these drugs are being sold in wholesale, and they equally come and sell to us in the hospital. If you think those drugs were not really that good, why do you think they go rely on such drugs?
That's a great question, and again, any medical professional who has the right ethics shouldn't really be practicing something like that, because again, it's something that should be frowned upon. Honestly, those medications, they're not properly sourced, questionable, either counterfeit, substandard. Some of them even have poisonous substances. So yeah, I mean, any licensed healthcare professional that procures medications through those illicit channels should really be held liable for that.
Okay. Despite the numerous crackdowns being carried out by the Ministry of Public Health, we still have the business is still thriving. Why that?
Yeah, so again, it's something, I mean, as far back, it's something that's already embedded in our society, right? It's like there are a lot of people that rely on these people on the street. So it's something, it's kind of, I would say, it's a mindset. So in order for that to really be stopped, there has to be a mind shift. There has to be like a paradigm shift so people get to understand what the dangers of these are. Because I mean, me growing up, growing up in Cameroon, I don't remember ever walking into a licensed pharmacy to purchase medication, to be honest. And now, having traveled abroad, having studied pharmacy, having practice pharmacy in the right way, and looking back in hindsight, I see a lot of things that I could have done better if I knew better, but I didn't know any better. Like when you look at them again, for the average person, when you look at the package of the medications being sold on the street side and the one you get from the pharmacy, they all look almost the same, right? Mm-hmm. So it's hard for the average person to tell tell the difference, and so that in itself it makes it hard to really stop that practice, because some people are just ignorant. They don't know they don't know it's bad. They just, because they've been doing it for years and years, and I've heard someone say that someone said, "Hey, I've been taking this since I was a kid. Mm-hmm. This is what I've been getting, and I'm still alive today." So there has to be that mind shift in order to move away from such practices. And another reason I can think about is lack of price transparency on medications, right? Because one of the reasons why a lot of people go to doctor, because
they're cheaper.
They're cheaper. I mean, at least there is that conception that it's cheaper. It's not necessarily cheaper.
It's cheap.
Yeah, so they're cheap, and we have done some market analysis ourselves, and we've seen some of these medications. They're like some of them are like almost the same price as in the pharmacy. But there are people who just don't even go to the pharmacy because they already have the mindset that it's cheaper on the roadside. But sometimes it's not.
But let's just take a case with our grandmothers or our mothers in the villages, mm-hmm. where they would prefer to go to such people because with just 500 francs, they mm-hmm. can get their treatment and they are fine. So I don't understand why they crack down on these people when we know some of these drugs are even being sold in hospitals, renowned hospitals, just that it's kind of hidden. But some of these drugs are being used in these hospitals. Don't you think it's a way of like trying to destroy these people's businesses? Those people,
okay. So again, it's as a public health professional too, right? I'm putting on my public health professional hat. So it is, even though it's like you don't do things because other people are doing it, right? Like, yeah, the fact that the renowned clinics are selling it, all those things are illegal. And nobody's held accountable when someone takes the wrong medication and dies. Nobody's held accountable. They're looking at it as strictly business, trying to make money. But there's that human side of it that should really be taken into account. So yes, it's, even though it's being done, it's not right. It's not right that these people get questionable medications and then sell it out to. I mean, there's several ways, and I think in certain hospitals there are low cost options for medications, right? So they're generic drugs, which are again a little bit cheaper than the brand name drugs, which should be that should be promoted instead of trying to get medications from the street side.
Okay. Let's now go to hinterlands,
mm-hmm.
where integrated health centers are found, let's say, over 5 kilometers away.
Mm-hmm.
In such a case, you have a man who is dying,
mm-hmm.
and the integrated health center is very far.
Mm-hmm.
And we have someone who can say, a doctor who has been treating lots of people with his roadside drugs.
Mm-hmm.
What do you advise such a family? To go straight to the hospital or try to get some, let's say, something like a first aid from this doctor, or just go straight to the hospital in such a case?
Yeah, so again, as a medical professional, that is unadvisable. And when you think about it, right, if this is such a great business and it's thriving in those areas, why don't we have real licensed pharmacists in those areas, right? That's what we should be thinking about. We shouldn't be looking at it as a substitute for quality health. Health is wealth. We don't want to compromise health in any way. We understand there's certain areas, those pharmacy deserts, right? They don't have many licensed pharmacies and all pharmacies around. But what should be done is to try to get to open up licensed pharmacies in those areas than encouraging people to get those. I mean, if the medication is good, if it's authentic, there's no problem. But the problem the chain of custody of those medications. Where do they get those medications, right? There was a study done by the World Health Organization that showed that the some like ibuprofen, they found chemotherapy, like cancer drug ingredients in ibuprofen. Just think about it for a second. You're having a headache and you're trying to cure your headache, and there you are taking a cancer medication, and it worsens it, you know. And I mean, there's so many people have had really bad reactions from medications that have been procured from the street. So it's just a totally, you know, bad habit. I mean, it's sad that some people live in areas where they don't have access to medications, but we, you know, the government and the public in general have an obligation to try to figure out how to get real authentic medications to these people because again, those people have no choice. Right? If that's the only thing they have, they're going to try it. Right. Yeah.
Right. If you're just joining us on the program, then know you're watching You and Your Health, or you're listening on the program You and Your Health. And I have as guest Dr. Leslie Asanga, Cameroon-born, U.S. licensed pharmacist, serial entrepreneur, and public health professional. Back to you, Dr. Leslie. So now we are going to be looking at self-medication. Lots of Cameroonians depend on drugs like ibuprofen, as you already said, drugs like efferagang, paracetamol, maybe when they're suffering with a headache or they're having a fever. Are there any side effects to such drugs, continuously consuming such drugs?
Yes, there definitely are. So, I mean, that's why drugs are classified into different categories. There are certain medications that you can get without prescriptions, right? Because those are generally, in the U.S., they say generally considered safe, but it's not 100% safe. There are still side effects to those medications. So, but the side effects are less than for, like right now, Tylenol, which in Cameroon it's paracetamol. Paracetamol in the U.S. has been, you know, advised. So the CDC just came out with a law advising pregnant women not to take paracetamol, right? So, but these are things that are currently common, you know, because it's been shown that to have certain paracetamol can pose certain problems during pregnancy. But that's what the average person doesn't know. So that's why it's even in these pharmacies. I'm not sure a lot of people know this, but if you walk into a pharmacy, and you can always seek advice from a licensed pharmacist on which of these medications you can take based on your health status, you know.
So now, what is medication adherence and why is it important?
Okay, so medication adherence just, I mean, in simple words, it just means sticking to your treatment plan as prescribed by your doctor, you know. So, and again, it's super important. First, you go see your doctor, especially for chronic disease states, right? You have diabetes. You go see a doctor and they say, oh, your blood sugar is high. They check your A1C. It's above normal. And they put you on medication to help you stabilize it. As long as you're taking a lot of those medications, you're probably going to be fine. But as soon as you start missing doses, then your health condition, you know, kind of starts degrading, and then it leads into a cascade of other things. Like, for example, diabetes, uncontrolled diabetes can lead to blindness. It can lead to amputation of the feet, right? So all those side effects, all of those effects of the disease that could have been controlled with medication adherence, you know, they show up if you're not taking your medication as prescribed. Another common example is like HIV, right? There are people who are taking right now. I mean, we've come a long way. There are medications, one pill once a day, and you stay undetected, right? Meaning that lab results don't show that you have HIV circulating in your blood. But that is as long as you keep taking that medication. As soon as you stop taking the medication, then the virus starts replicating, and then you start developing into like the effects of HIV and get into the AIDS range of it, which is when you start having all of those, you know, bad signs and symptoms. So medication adherence is really, really, so it simply means you take the medication as prescribed by the doctor. You take it the right frequency. If it's 3 times a day, you take it. If once a day, you take it once a day, and you don't skip a dose. And for the most part, if it's not working, then the doctor can switch to another regimen that's working for you. But if you're not compliant with your medications, if you're not adhering to the treatment, then it's hard for the doctor to tell whether it's the medication not right for you, or is it because you're not taking the medication as required. I actually had a patient like that. They were prescribed insulin, and this patient wasn't taking it as regularly. They weren't taking it as prescribed, so they were skipping doses, and every time they come in for an appointment, the blood sugar is elevated, and we kept increasing the dose of the insulin, right? They kept increasing the dose of the insulin, thinking that it was the insulin that wasn't working. Until come to find out, it was her daughter who said no, the mom doesn't take the prescription. So with close monitoring, they figured out she needed a very tiny dose. She just had to take it. Medications don't work if you don't take them, right?
Okay. To participate in the program, you can call us through the following numbers: 655-511111. I repeat, 655-511111 or 652025050. 652025050. Back to you, Dr. Leslie. What's the difference between medication adherence and medication compliance?
Okay, so medication adherence is more of it's more of an access issue, right? So if the doctor prescribes a medication, you get prescribed the medication, you don't buy it, right? So that's lack of medication adherence. You're not adhering to the treatment that was prescribed to you, or maybe and this happens for quite a few reasons. People get and it's reasons sometimes beyond somebody's control. You get prescribed the medication, you get to the pharmacy, you figure out the cost is over the roof. Like it's like maybe $100,000 for that medication, and you don't have the money, and you don't actually get that medication. That's an example of medication adherence. Okay. Then compliance is, you get prescribed a blood pressure medication to be taken twice a day or 3 times a day, and then you only taking it once a day, or you skip certain days. So that's medication non-compliance. Yeah.
So now tell us about your farm pills to me, which is very applicable here in Cameroon, and I strongly believe your farm fits the Cameroonian context.
Okay, so your farm is an easy way to search, find, and pay for medications in sub-Saharan Africa. So for example, you go to a doctor's office and you get prescribed the medication. You have the prescription in your hand. The first thing that comes to mind is you're wondering where to go, right?
Exactly.
Yeah. So you get on the app, the Your Farm app, you type the name of the medication. It will show you pharmacies that have that medication in stock, from the closest to the furthest from you. So then you know exactly where to go, and you're not wasting time going around from one pharmacy to the next. And it also shows you the price. So when you get to the pharmacy, there are no surprises, because we've heard of cases we've partnered with a lot of licensed pharmacies that are working on that. We've done a lot of market research with, and they're telling us a lot of people come to the pharmacy and get told the price of their medication, and they leave without it because they don't have enough money. So your farm kind of helps with that. So yes, if you don't have enough money, you need to get it from somewhere, or you need to figure out where to get it before you get to the pharmacy. The advantage is that, one, you know that exactly if it says your medication is available at Equinoxe, you go into Equinoxe, you find the medication there. Okay. You're not going around from one place to the next. And when it says the medication costs 5,000 francs, when you get there, it's 5,000 francs that you pay for. So it kind of helps with a lot of different things. One, it helps fight this road and street medications, right? So because we're only enrolling licensed pharmacies on our platform.
What makes your farm unique from other applications that exist?
Yeah, so we've seen quite a few, and throughout sub-Saharan Africa, we did a thorough market analysis, and a lot of those, they'll show you where pharmacies are, right? A lot of those apps, they'll show you where pharmacies are. They'll show you which pharmacy is on call and all of that, right? But we go further. We're not even sure, because again, what sense does it make? What use does it serve you if you see that pharmacy that though is open, you get there, they don't have your medication? A simple Google, you don't even need an app to locate pharmacies anymore. A simple Google search will show you which pharmacies are around. So the unique value proposition we have with your farm is that when you get on the app, it shows you exactly which pharmacy has your medication in stock. And we it's real-time data that we get from these partner pharmacies that shows you.
And for our mothers who are not very used to it, phones, is there any other way of accessing such pharmacies without going on social media?
Yeah, so we have a customer service line that anybody, if you're looking for a medication that is hard to find, you can always call that a customer service number. We'll be happy to help those people that are not tech savvy, right? Exactly. To be able, we'll be able to do that search for them and then tell them exactly
how to purchase,
where they can go to get it. To get the medication.
So now, we were talking about roadside drugs. What advice do you have for the Cameroon's Ministry of Public Health as far as a crackdown on the sale of illicit drugs on roadside is concerned?
Yeah, so I think the problem is it's a big problem to tackle, right? And I can see why. It's been heavily ingrained in our society. Most people when they're sick, the first thing, they don't even think about the doctor's office. Especially if it's not that serious. Most people think about just going to the guy down the street to get it. So it has to be it has to be fought from different multiple angles, right? They're already going around seizing these drugs and all of that, and that's one that is good. Educating the public. I know the ministries of public health has been trying to educate the public about that, and it's also another way, right? Because if there are no customers, there won't be business for these people, because for them it's strictly business. A lot of them don't have any medical expertise. They're just out to make some quick money. Right?
You're right.
So I think a proper education of the public, with all the other measures that are currently in place, can help slow this down.
Thank you so much.
All right. Thank you.
That was Dr. Leslie Asanga. He is a Cameroonian-born U.S. licensed pharmacist, serial entrepreneur, public health professional. He's equally the co-founder and CEO of Pharmacy, a mobile application that makes it easy to search, find, and pay for medications in sub-Saharan Africa. And that's it for this edition of the program You and Your Health, aired on Equinoxe Radio Multimedia. Stay blessed in the company of more programs on Equinoxe TV and on radio.